Welcome to our last module on respiratory protection, where we discuss respirator care, cleaning, and storage. As always, we'd like to thank the institutions and individuals listed on this slide. In this module, we'll focus on care, cleaning, and storage of reusable elastomeric respirators. We hope that by the end of this module, you'll be able to describe how to clean particulate filter cartridges, explain how often cleaning and disinfecting respirators is necessary, and list the steps for safely cleaning and disinfecting elastomeric respirators. Again, our focus will be on reusable elastomeric respirators with filters that are enclosed in cartridges, as you see here. We'll discuss both cleaning, the removal of dirt, and disinfection, the removal of pathogens. Only use the recommended amount of bleach, as bleach is a health hazard and causes equipment deterioration. Not all filters come in cartridges. Since filters must be in cartridges to be cleaned and reusable, healthcare facilities should not use other types of filters. At the end of the shift, cartridges should be wiped down with cloth wrung in a bleach solution. The filters inside the cartridges must not become wet, so never let them soak in water. Users should avoid contact with the filter media inside the cartridge. Reusable respirators should be inspected for damage before each use. These are the steps that are needed. Let's compare the basic steps for cleaning respirators after each patient encounter and at the end of a healthcare worker's shift. Between patients, the respirator should be wiped down on the outside using a cloth wrung in bleach solution and allowed to air dry. At the end of the shift, cleaning should be more thorough and cartridge filters should be removed. End-of-shift cleaning should be done centrally with dedicated staff. You can also assign people to pick up and drop off the respirators. Laminate and post cleaning instructions if possible. We recommend cleaning the elastomeric respirators in a centralized location at the end of the shift. Here is a list of equipment, which is also in your handout. If there are a number of respirators to be cleaned, consider having 2 people so that the first person washes, rinses, and places the respirator in dilute bleach solution. The second person takes the respirator from the dilute bleach solution and rinses it and dries it with a clean pair of gloves using clean tongs. If only one person is cleaning, they will need to use clean gloves for removing the disinfected respirator. Since there are over 20 steps for cleaning the respirators properly, it's important to understand the big picture. The detailed protocol is in your handout. Here are the major steps. Don PPE and remove the cartridges. Scrub the respirator gently in warm water. Rinse the respirator and then use tongs to soak the respirator in dilute bleach for 2 minutes for COVID or 10 minutes for TB. The tongs are used to keep the respirator under the solution. Don new gloves and use a clean pair of tongs to remove the disinfected respirator, rinse it in fresh clean water, and then air dry. If you have a second person with you, they can remove the disinfected respirator for you with the clean tongs. If you can use a sink with running water to rinse the respirator after cleaning and disinfection, you will only need 2 buckets. If you do not have running water, you will need 4 buckets. If you're using a sink, remember to wipe down the faucet after cleaning. With tuberculosis exposure, you'll want to double the concentration of bleach and immerse the respirators for at least 10 minutes, as written in your handout. The concentration of bleach in water for exposure to viruses is also provided in your handout. The next few slides have more detailed instructions that can be found in your handout. These are good to have printed and posted for your staff. After you gather your equipment, place a towel with tongs and a second towel nearby. Prepare 4 buckets of fresh water or 2 buckets of fresh warm water if you have running water available. Do not use boiling or hot water. Don PPE. Pour 1 ounce of dishwashing liquid into bucket 1 and 1 ounce of bleach into bucket 3. Remove the filter cartridges by unscrewing or turning them to the left. Do not remove the valves because they are easy to lose. Wipe the cartridge filters with cloth wrung in dilute bleach and then place them in a clean bin. Without removing the straps of the respirator, immerse it into soaky water. Gently scrub the respirator with the brush and soapy water inside of the mask to avoid damaging the valves. Do not brush the eye lenses of full-face respirators. Rinse in fresh warm water. Running water is better if available. Thorough rinsing is important to keep detergents and disinfectants from drying on the respirator. For disinfection, place the rinsed mask into the bleach disinfecting solution of bucket 3. Submerge the mask completely, and while it's merged, use the tongs to turn the mask over. Clip the mask with tongs and leave submerged for 2 minutes. After the 2-minute immersion, either change gloves and remove the respirator with a fresh pair of tongs, or have the second person remove the respirator with the fresh pair of tongs. Rinse the mask completely. Dry with a clean cloth or allow to air dry. When it's dry, reassemble the mask and cartridges, empty the buckets, clean the area, and remove your PPE. After cleaning, respirators should be stored away from contaminated areas in a sealed container or bag. In summary, disinfecting respirators at the end of each use is needed to remove microbial pathogens. When cleaning respirators after shifts, PPE must be worn. The cartridges must be removed. Only the respirator is submerged and scrubbed in water. The respirator is disinfected with a bleach solution and then rinsed and dried. This module includes a handout. Here are some links to more training videos. Here is a link and refresher to donning and doffing PPE, which is important for cleaning respirators.